On day 4 of the Dublin Horse Show, and we've got Dr. Lucy Chadwick here today. And Lucy, we're going to talk about the fat pony in the room.
We are indeed. So today we're going to be covering off a little bit on EMS, a little bit on Cushing's, and how do they link to laminitis.
Yeah, they're real buzzwords at the moment, and a lot of people don't understand the differences or how to distinguish between them, and then how to manage each condition.
Exactly. So this morning we're going to be touching on the differences between the conditions, the similarities between the conditions, and then later on this afternoon in part 2 we're going to look a little bit more at the management of them.
Super.
So, as you said, can be quite confusing. We've got EMS, we've got our Cushing's. How do they link to laminitis? Well, let's try and simplify that a bit.
Super.
So, hopefully this is going to help us simplify matters. Let's look at EMS first. So with EMS, we're generally looking at more our middle-aged ponies and horses. That's one of our main distinguishing factors actually with our Cushing cases. While we might consider them to be fat, and they will be fat, they often lay down fat in more unusual areas than you would expect in just a fat horse or pony. So as you can see from this little guy over here, we've got quite what we call a cresty appearance. They've got fat deposits up the neck.
Okay.
They've got quite a lot of fat deposits on the belly. And also when you look at them from behind, you're getting these dimples down both sides of the tail, right down that area there. So it's not just what we would consider fat, it's in unusual places. Generally these cases will have a normal coat, so they're quite normal in appearance otherwise. And as I said, they will have quite a poor top line. So they've got this cresty appearance, but they also lose that nice strong top line on their back. In contrast, when we look at our Cushing's cases, these are generally a little bit older. So our average age is about 19 years for Cushing's cases.
Okay.
They'll generally have quite a lot of muscle wastage. So while they might be quite portly, when you look at their actual muscle bellies, there's quite a lot of wastage there and they haven't got optimal muscle tone. This curly coat that we can see here, this is probably a bit more on the mild end of the spectrum. It can be extremely curly, but it's quite a distinctive sign for our Cushing's cases. A lot of other things can happen because of the hormonal imbalance. So they can be quite lethargic, they can have increased sweating over and above what you would expect, and they can have what's called PUPD. This means drinking more and peeing more.
Okay, so this is when you'd see in your stables, they'd have very, very wet beds, they'd be always at the bottom of their water bucket, you know, and I suppose in these cases it's probably more sensible to have a water bucket, would you say, than free-range drinkers, just so you can monitor it more so than anything?
I think so. If you have the ability to be regularly retopping that bucket, so they're not going to get dehydrated, absolutely it'll help you to monitor that. Yeah. And certainly if we're doing some investigations as to whether we think they're Cushingoid or not, we might ask you to move to buckets so we can actually measure how much water they're actually drinking.
Okay, super.
Yeah. Now the important thing to say is where they do cross over is both of these conditions can cause reduced fertility and laminitis.
Okay.
And animals as they get older, so horses and ponies as they get older, can actually end up having both conditions at the same time.
Right.
So let's think of them distinctly just for the purpose of today.
So if we're looking at our older horses with Cushing's and the average age being 19, our brood mares, our older brood mares, they would be at high risk potentially of having it.
Yeah.
So, and then also during pregnancy, those mares get a certain level of insulin resistance anyway, so it can all kind of be exacerbated at that point. Yeah. And if your fertility is being reduced, I suppose there's things that we have to consider when we're looking at, getting these mares back in full when they're older.
Exactly, absolutely, absolutely. So let's look a little bit closer at EMS, equine metabolic syndrome, to give it its full title. So really this is a prosperity disease. This is where they have nutrient oversupply combined with inappropriate movement and training. So in a nutshell, they're eating like they're a racehorse or a supreme athlete, but they're training like they're a darling little pony who's maybe going out once or twice a week.
Okay.
So it's just a mismatch between what's going in and how much energy is then being used, which is going to lead to weight gain and obesity.
And it's back to one of our golden rules of feeding for the purpose intended.
Exactly that. So we want to feed them for the actual workload
job they're
doing. Yeah. So how common is EMS? So it's really quite hard to get figures, but what we do know is that from, most of the studies would take place actually in the UK, interestingly. They've got a bit of a bigger horse population. So the prevalence of obesity in various equine populations ranges from about 21 to 45%, which is really quite a lot. And as we know, obesity is our main risk factor for EMS. And we also have some predisposed breeds. So breeds like our Shetland ponies and our miniature horses have an actual predisposition towards EMS. So with these in particular, it's very important to monitor their diet.
Now, is this coming back to the fact that the likes of your Shetland ponies, your Welsh Section A's, they were bred to live on the sides of mountains?
Yeah.
They were bred to live on rock. and forage and, you know, forage around for whatever was available. And now we've taken them into a more modern husbandry management system, and we're feeding them high starch diets and things like that.
Yeah, and they're getting lush grass.
Yeah.
They're not living on rocky scraps of grass. They're living in beautiful paddocks. We're feeding them concentrates. It's very different to what maybe they were bred to do originally. So that's probably quite linked to that. So, in a nutshell, what is equine metabolic syndrome? So it all comes down to a thing called insulin resistance. So this is actually quite similar to, say, type 2 diabetes in humans. That would be one of the closest correlations we have. And it's basically a failure of the body to respond to insulin. So it results in a failure to control our blood glucose levels. So they're eating, glucose is entering the blood, but the insulin isn't responding to that. So it leads to a really high level of insulin in the blood. And we'll talk about what that then does a little bit in a minute. Now, if we look at Cushing's. Now, Cushing's has a very complicated scientific name, PPID, or pituitary pars intermedia dysfunction. Don't need to remember that, we can call it Cushing's. But it really just relates to the pituitary gland and what the whole disease is related to. So what happens is the normal mechanisms by which we control hormone production by the pituitary gland, a gland in the body, is damaged. So the inhibition of this production is lost. So we get an excessive production of our normal hormones from the pituitary, they enter the circulation and they affect the whole body.
Okay.
So that's really what's happening in Cushing's.
Right.
Now, where does laminitis come into this? So pretty much anyone who hears EMS or Cushing's, you jump straight to laminitis, right? We're thinking, where does laminitis come into this? And how they are linked is that both conditions can lead to laminitis through high levels of insulin in the blood.
Okay.
Now the mechanism of this is slightly poorly understood, but what is believed is that this then affects blood flow to the feet.
Okay.
Now, let's touch on laminitis. What are we talking about? We talk about laminitis. Everyone who's had a horse or a pony or been involved in the horse world will have probably come across a laminitis case at some point. So what are we talking about? So, we'll know the hoof, nice hard shell.
Yep.
Inside the hoof, we have these things called laminae. And laminae are what hold our hoof onto the bone in the foot.
Okay.
So, normally this is great, works really, really well. But in laminitis, those laminae get inflamed, they get hot, they get sore. And if you think about if you ever have an injury, say on a limb, it'll swell, right? It's sore, it gets inflamed, it gets hot, and it swells.
Yeah.
Think about the hoof. It's a solid shell structure. Swelling inside that, it has nowhere to go.
Yeah.
It's just going to get more and more and more pressure in there. And eventually what that does is it breaks down the connection from those laminae to that bone. The bone can rotate and come through the bottom of the foot. And as we know, that is the absolute worst case scenario
Disaster,
that we get to in laminitis. So that's what our laminitis is, and that's how our conditions are leading to our laminitis.
Okay.
So both conditions can cause laminitis. Of our laminitis cases, about 90% overall are caused by EMS.
Okay.
Of course, there's some non-endocrine, not just these diseases can cause laminitis.
Absolutely.
But about 90% of our cases that we're seeing are linked to our EMS.
Okay. Super.
Yeah. So that's a little quick whistle-stop tour of our EMS, our Cushing's, how they link to laminitis, and in part 2 this afternoon we're going to be going through our management of these conditions.
Yeah, no, that'll be great because it'll give people an indication of how to manage the different types of horses, and we'll talk a little bit about brood mares and things like that with laminitis, and you know how to manage them especially, and you know, so that's been brilliant. Thank you very much, Lucy, and we look forward to later on.
Brilliant.
Thank you.
See you then.